Very correct. You're very correct. We're able to establish the fact that you pay as much attention that you pay to physical wounds, you pay that much attention to your emotional injuries as well. So when things like rape happen, treat it like an accident. Because it is an accident. It's not even you treating it as an accident. It is an accident. So just imagine what you would do if you were run by a car. Imagine what you would do if you were hit by a bike. Imagine what exactly you would do, and take the same action with that same energy. Take the same action with that same energy, and it's a process. So try as much as possible to complete the process the same way you're encouraged to complete your medication when you go to the hospital. So try as much as possible to complete the process. And the very reason I'm using this illustration is so that we'll be able to relate to it. You know, that was why I used the example of if you're bleeding, you're involved in an accident and then you're bleeding. If you bleed for so long, you're going to lose so much blood. And if care is not taken, if no action is taken, then you lose your life. If you start treatment and you don't complete your treatment, the wound can get infected, and then you have to start over again. And then they will tell you, oh, now we have to do this. Now, have you seen people that they had injuries infected, maybe in their limbs? They don't say, oh, this thing is so infected, it's so terrible, we now have to cut off this limb. You know, so emotional health, mental health, psychological well-being is as important as your physical well-being, because your physiology and your psychology, they function together. Now, I said the story of one of my clients that was having palpitations, and she had already, gone to the hospital and started taking medication. But the medical doctor didn't streamline to the cause. They were only able to know, oh, she's having palpitations, she's having chest pain. And she was already on meds. And what will happen before you know it, they'll tell you 26 years old, she had stroke. Oh, it was this. She was already having cardiovascular illnesses. Why? Because when she sits, she just gets tensed all of a sudden. At times, she doesn't even have flashbacks, but she just finds herself breathing hard. And that is a psychology controlling a physiology. Because what happens then? You have hormones in her body. Now, adrenaline, it shoots up. Adrenaline is only meant for flight or fight mechanism in the face of danger. But this is someone seated, and then all of a sudden she's having palpitations. Her pupils are dilated. Snake didn't enter the room. There's no lion in the neighborhood. She doesn't need that energy, right? But all of this happens in her body, and then if it continues over time, it will happen that she's having increased heartbeat. Maybe I've been saying palpitations since maybe we don't know palpitation. Increased heart rate. So now see what has happened. A thought, a mind issue, it has translated into the body, secreted hormones, it has caused neurological activity. Nerves are sending responses, heartbeat is increasing, she's sweating, pupils dilated as a result of something that is emotional. So we can't afford to joke with our emotional health. We cannot afford to joke with our emotional health. Now there are persons that it's persistent headache. And then you go to the hospital, you're going to be given medication. What do you want your doctor to do other than give you medication to treat what is wrong? Or what he thinks is wrong? Because what happens is, what you're presenting is all will be treated, but the root cause will still be there. Now, some persons get very aggressive. They get very angry. And at the slightest opportunity, they flare up. But do you know that anger causes ulcer? Yes. So anger can lead to cardiovascular illnesses, and anger also causes peptic ulcer. Because there's a reason we are the way we are as humans. So you're getting angry, your facial tone, your facial muscles, the tonality changes, you're expressing all of that. Hormones are being secreted in your body, enzymes are being secreted in your system. It increases, your proton pump, that's hydrogen, which is acidic in your system. And then when you worry, how much do you eat? So you notice you don't really eat. Something is wrong with you, and then you're worried. Now, okay, let's take it. You see, a typical rape experience. You now start locking yourself up in the room. You're not talking to anybody. You're not eating. You're even trying to sleep. You're not sleeping. What will happen one day? Oh, maybe you fall ill, and then the next thing, what's wrong with you? What's wrong with you? They'll take you to the hospital. You're not saying they're giving you multivite. You've lost so much weight. They're going to be dealing with symptoms, and meanwhile there is a root cause. Now I can communicate these things this way because I have a background in medical sciences, and while I was in that line, I was able to learn that really our psychology controls our physiology. So I just felt after this I'm going this way. So your emotional well-being is very important. When you're happy, you feel light, you eat, you're bubbling. But when you're not in a good place, for example, when things like this are happening, for let's say a typical rape situation, and you're just locking yourself up, you're worried, you try to eat and then you find yourself stooling. I don't know if anybody has ever experienced that. You notice that there's a period that you're just going to the toilet, you're using the loo consistently, anything you eat. That's IBS, irritable bowel syndrome. Anything you eat doesn't stay. It's because you're not in a good state of mind. So it's important that we take care of ourselves, our mental health, our psychological well-being. It is extremely important because weight loss, weight gain, healthy living, whatever it is, when you're in a good place internally, you're in a good state of mind, you'll be surprised how things start falling in place. When you're happy, you attract the right people. When you're gloomy, what happens at some point, you even lose relationships. I don't know if anybody here that is going through it, because nobody knows what you're going through. All of a sudden you start acting up, you're edgy, you snap at everybody, or you're gloomy, you don't even want to talk to anybody. It will take special grace for some people to remain in your life, because there's a limit to what everybody can take, and then people start getting tired of you. You lose friends, you lose opportunities, you lose favor. But when you're happy, you're in a good place, you're interacting, you walk into a place and you radiate this very good aura. The energy there is contagious. Everybody knows that you're, now there are people that we call never a dull moment, and even if they're going through something, they're like that. No, I'm not talking about the fake it till you make it. I'm talking about you're actually, you're in a good place, you're mentally healthy, you're okay. You carry that energy around you. Guess what? It's easier for you to attract favors because people see you and then you smile and wave. Not they see you and you're trying to run away, or you're trying to hide or something, or they see you and you just snub them and go away. So the benefits of getting help, going for therapy after incidences like this, they're just so numerous. It puts you in a good place. It helps you be light. It helps you be healthy. And it's a long run thing over the years. Thank you.